Our needle exchange program, we're in partnership with Superior Points. They supply us with our supplies. They also pick up all our used equipment, and it's all in bio bins, get sent out and incinerated. And they reclaim the metal and do something with it. I don't know, turn it into ashtrays or something, I guess. But generally, yeah, people just come in and they will specifically ask for one item or another, like water, tie, cookers, syringes, condoms, everything. And plus information. They take what they want. They bring in their dirties if they want, if they have them with them, or Superior Points will pick them up.
Well, I was an injection drug user for like 14 years, so yeah, and was pretty active in the community that I lived in at the time, or the communities, I guess, I lived in, as far as like trying to advocate to have the needle exchange programs, like the scope to be more broad as far as like, you know, not just open Monday to Friday, 8:30 to 4:30.
Mine's a similar background. I'm a past injection drug user. I started very, very young. Yeah, I was on the other side of all this, and then when I cleaned out my life and got my stuff, the pieces that needed to happen all happened for me, luckily, and I was able to break free. And then I figured, you know, it's why not use what I got and put something back in, and that's what I've been doing. Say you and I are using needles, okay? We're using together. We're both using the same water. I will inject, okay? And if I don't rinse my needle and I go in and I draw more water into that needle, I've now deposited blood into that water, okay? Whether you see it or don't, it's there. You go draw up that water on your next one, you have a potential of drawing up my blood. If I'm HIV or Hep C positive, there's a transmission route right there. So that's one of the main reasons that we give out the water, is to prevent that. This is the one most people take. The lid, they come apart like this. And then you take, these lids snap on. Once this lid snaps on, the only way to get it open again is to smash it. The reason we give out the spoons is specifically for people were sharing tablespoons or teaspoons. They were sharing, so lots of people were using the same spoon. There is viable virus on when they're doing that, because they're not, most people don't clean them out, or they do a shot and then they go and do another shot right away with the same syringe. So they'll use the same spoon. If you have lots of people doing that, they've tested them previous, there's viable Hep C virus on there. HIV is very weak, dies very quickly outside the body. Hep C, not so. Hep C can live a very long time outside the body. Okay, that's the reason we give out the spoon.
Like there's been so much research done that shows that not only does it help prevent people from getting sick, but it saves money for taxpayers, and that's what the huge, that's the huge sort of goal, I guess, that people seem to care about. So I think, yeah, I mean,
because the government's not going to do something it's not in their best interest and not in the public's best interest. These programs are in the public's best interest. The whole idea is we're trying to cut down on infection rates for Hep C, HIV, trying to stop some of the permanent damage people are doing to themselves by their use. My job's not to sit there and tell somebody, you're bad for using, because I got no right to do that. I do have an obligation to try to make things easier for them, to make their lives a little bit better. And if I can do that with syringes, great. If I can do that with coffee and a cigarette, great. However it gets done, it needs to get done. And if somebody's got an argument out there that can't be countered, I'd like to hear it. So